535 presents The Secret Doctor, written by Dr Max Skittle and read by Kris Dyer. For my family, and to everyone sitting in a waiting room, sorry, we're probably running late. Prologue. What exactly is a GP? A general practitioner, GP, is a medical doctor who treats acute and chronic illness and provides preventative care and health education to patients. A bit on the dry side, Wikipedia. But, yeah, all right. Still, let's add a little more sauce to the job, shall we? Here's what I think. Being a GP is about compressing life into 10 minutes, 600 seconds. You've got to be prepared to manage the physical, mental, social and spiritual health of the person sitting in front of you in all its glorious, confusing and terrifying totality. Cradle to grave. No room for error. It's about looking through the window of that person's life and trying to make it better somehow. To make it healthier, happier, longer. Embedded within a community, the job asks you to be detective, mediator, doctor, and counsellor, unearthing why that person feels the way they do. Yet, the surprising thing about such a life, my life as a GP, is that the hardest part is everything in between the medicine. It's the anger, the sadness, the frustration, the love, the joy, the tragedy, the fear, the compassion, the hate, and the loss. You go on a journey with that patient. Life in 10 minutes. Tick, tock. And yet, strange as it may sound, sometimes they don't even realise you're there, like some tacit travelling companion. Hidden away in a pathology result processed, a phone call to a specialist, a clinical letter, read and filed, names without faces. And then, at the end of every day, you go home, having collected up the emotions and concerns of society, and try to live your own life, unencumbered. Unsurprisingly, this means learning to compartmentalize the job from your own life is a mandatory requirement, one that is, in reality, always out of reach. You have the privilege to see the light and dark of life, and all those endless shades in between, which is where life really happens, where the stories are told. Like a chameleon, it's about always adapting to that person in front of you, working out how to meet their needs, their wants, their expectations. And when they leave, you then have to work to digest the truth that it's you who has ultimate responsibility. You manage their risk, your diagnosis, your decision, your treatment. Get it wrong, and they suffer, not you. Plus, you'll probably get sued. Yet, with all this omnipotent worry and stress for company, my life as a GP is fundamentally, truly, and resoundingly fucking brilliant. It's why I chose to be a GP. For the people. To help. And I wouldn't dream of doing any other job. This book is about why. This is my story. Introduction. Monday, the 4th of June, 2018. My name is Max Skittle, and I'm a 32-year-old GP. It's 7:45 a.m. on a Monday morning in June 2018, and this, as it so happens, is the perfect day to start the story of my life as a GP. Right now, I'm sitting at my desk in the inner-city GP surgery where I've worked since qualifying as a GP 3 years ago, so you're joining me at what is the relatively fresh and exciting early stage of my career. Yet, right now, that's by the by, as all I can do is stare. Stare down at my violated crotch, not quite believing my appalling luck. Stained crusted white this morning, courtesy of what, at the time, seemed like an innocent spoonful of whole-fat Greek
Sample complete. Ready to continue?